My name is Hinga. Welcome to my YouTube channel. In case you're new here, kindly subscribe, like, share, and comment. So today I am at a dental clinic with a very great doctor called Dr. Roy. Dr. Roy, karibu sana.
Thank you, Belton.
Yes.
Hello.
Hello.
How are you?
I'm very fine. Karibu sana, Dr. Roy. So today we are here and I'd love you to tell us more about the dental chair because I have noticed that so many patients come into the dental clinic and immediately they see the dental chair, they develop fear, they develop phobia of it. They see as if it's an extremely complicated thing that is being done to their mouths. So before we even go there, so kindly tell us about yourself, where we can find you.
Okay, my name is Roy, as you heard. Yeah, we're located in Githurai 45, opposite Equity Afia. You can find us there. And yeah, today we'll be taking you around the dental units. We do actually all kind of dental procedures, from extractions to bracing. So you are welcome. Anyone who's watching this video, feel welcome in this dental.
Thank you so much. So we are going straight to our dental chair.
Yeah.
Yes.
So yeah, it's true. I've actually realized when patients come here, there's usually that fear. But I guess it's anything that looks like a hospital. But it's a hospital here. But anything that looks like a hospital usually does make a patient develop some fear about the place. Yeah, they develop a phobia. They all shaken up. So what we try to tell the patient is relax. We try to let the patient relax and calm down, and so that we may go on smoothly. Yeah.
Wow, that's very amazing. So, Doctor, do patients react to the color of the dental chair?
No, I've not had that case so far, but I've had patients who react to bright light, to maybe if you place your equipment earlier and start showing off needles and that and the some taste. So about the color, I'm not so sure, but I'm pretty sure there's some people who see red as a terrifying color. Yeah.
Wow, that's amazing. So, how does the dental chair work? How does this one here work?
How does the network? Okay, okay. So the network chair is adjustable. It's an adjustable chair. As you can see, it has a. This is the place where there's a joint. The joint where it can go up, go down. It can be adjusted in any position. You see, you can either make it more inclined. You can make it more reclined, depending on what position you want, what you are comfortable with, what we are comfortable with. That is what we'll go with, depending on the procedure. Thank you.
Wow. So, what about this one here, the light itself?
So yeah, about the light. So the light it's adjustable. It has various kind of lights. It can be brighter. It can be a bit dull. Yeah, but depending on what the patient and what we are trying to see to locate the tooth, we need either brighter or a much dimmer light. So it is usually hand sensitive. You just swipe your hand and the light comes out and off, on and off, on and off.
Wow.
Yeah.
And then, Dr. Roy, what is this one here used for?
Okay, this is the dental platform. In here, I place all my equipment, starting from my elevators, excavators, any procedure that I'm going to be doing. Depending on the procedure I'm going to be doing, I'm going to be placing my equipment here. If the elevators, if it is forceps, if it is extractions, yeah, that is what this is for. Just to place my equipment for comfortability instead of trying to take the equipment from one place to another. You see, the hassle is not necessary. Yeah, just place all the
Wow. And what about this one here, Dr. I see it has, so kindly tell us more about it.
too much. Okay, this is the okay from the platform. We have the holder. These are the holders. It holds different kind of bars. A low speed bar, a high speed bar, a low speed bar, a blower, and scaling equipment. But as you can see, there's a second one over there, which is similar to this. But mostly what that one is for the dental assistant. This one is for my use.
Yeah.
Yeah, so the scaling it is used to remove plaques and so on and so forth. The bars here is where we place the bars and step on. Yeah, you see what you're showing? Yeah, thank you. That's it. Yeah, and when you step on it, it rotates. It rotates at a high speed, rotates at a low speed, and this blows off saliva or irrigates the mouth, depending on what you're doing. Yeah.
Wow. And what about this one here, Daktari?
So this is it's where the patient spits any excess blood, excess saliva, any medication that we've given on him. That's where the patient spits out whatever he's moved from his mouth, whatever.
Wow. And also see we have a screen here. What is the function of this screen?
So, okay, thank you. As you have mentioned, yeah, many patients wonder what should we watch in the screen? Are we gonna keep press an animation here so that it may be more comfortable? But no, this is not an animation screen. Though you can watch movies here because there's a flash disc holder over here. So the screen we usually use it to take pictures of before and after photos. Before and after photos of the teeth, maybe. Let's say you are doing a filling and you want the patient to see how it was before and how it is after. That is how we do it. So this is the camera as you see. It shows different parts. So you can take like 4 photos and display to the patient. Yeah, you can take maybe a before picture and an after picture. Yeah, thank you.
Wow. And what about, I see there's a machine here. So can you tell us about it?
So for the machine, that's an air compressor. It is used to actually to send pressure to the dental chair where the rotator that is using the air compressor. That's how the bars rotate. That's how the bars rotate. That's how the blower removes air and so on. That's how it is through the air compressor that most of these things function. Without the air compressor, there won't be rotational movements in these bars. There won't be vibrational movements in the scaling machine. Yeah. So yeah, that's the use of the air compressor. So it is an important equipment here.
Wow. So Daktari, do we use needles in the dental clinic?
What do you mean needles? Yeah, definitely use needles. But depending, as I said, I think I've said this a lot, depending on what procedure you're doing. If it's something like scaling, a minor procedure, there's no need for the use of needles. But if it is a procedure which is gonna make, which it's gonna be, which are gonna be maybe impinging on the gums, maybe extraction, which can cause pain, you have to numb the patient. You have to numb the patient, maybe using the lidocaine or whatever is available. But yeah, some extractions you have to inject the patient, you have to numb the patient for the root canal, you have to numb the patients for the most of the procedures. You have to numb the patients. Only a few that you don't numb.
Wow.
Yeah.
Thank you so much, Daktari. It was a pleasure having you today at my show. So thank you so much, guys, for watching. Make sure you watch, you continue watching so that you can learn more on dental and also other things that I will bring so we can learn together.